We're going to move on now to our second session, and this one is titled A Collective Approach to Promoting Disability Access and Inclusion Across MedEd. And this talk is going to be moderated by Carly Cood, who is a good friend and our disability service provider for Stanford Medicine. And I'm just really excited to hear your talk, and I'm going to pass it off to Carly now.
Thank you so much, Pete, and thank you, everyone. I'm so pleased to be here today, especially following Lisa Meek's incredibly moving keynote speech, because I think that what our session will offer today is a view into how we are doing this work. Because, as Pete mentioned, I am the disability resources provider professional here at Stanford School of Medicine. But by no means am I working in a vacuum. In fact, the way that I do my work is by bringing in leadership, including our students. So that is a wonderful segue for us today. I'd like to take a minute and introduce myself a little more formally. As I said, my name is Carly Coot. I use she and her pronouns. I'm a middle-aged white woman with shoulder-length brown hair, and I'm wearing a gold necklace and a navy blue button-down shirt. Our presentation today is going to be both a presentation from my cohort here and some question and answers. But I'll go ahead and let everyone introduce themselves. Let's start with Pri.
Good morning, everybody. It's a pleasure to learn with everyone today. I'm Pri Basavia. I use she, her pronouns. I'm a middle-aged internal medicine professor, advising dean for inclusive learning, and co-director for our learning communities with Dr. John Kugler. I am petite, a South Asian woman with black hair, brown eyes, and a red dress.
Thank you, John.
Hello, everyone. My name is John Kugler. I am a middle-aged white male with short, light brown hair, graying around the temples, wearing a gray hoodie. And I am an internal medicine physician. I get to co-lead the E4C program with Dr. Basavia. I'm also the clerkship director for internal medicine at Stanford Medical School.
Thank you, Jordana.
Yeah, hi all, I'm Georgiana Burnside. I use she, her pronouns, and I'm a fair-skinned female with blue eyes and wavy blonde hair with a bright green shirt on. Just a brief intro to who I am. I am a rising fourth-year medical student that lives with a spinal cord injury. And I'm here today to discuss kind of the clerkship experience from the lens of my own personal, more physical disability, and then more broadly in the ways that we've worked together as a team to approach hopefully a kind of universal system to implement equity and accessibility into each individual's learning experience.
Thank you. And Amy.
Hello again, everyone. My name is Amy Bagwadia. I use she, her pronouns. For my visual description, I am a young South Asian woman with long black hair and a bright blue shirt. As I mentioned a little bit earlier during today's introduction, I am a medical student here at Stanford School of Medicine. I have served as the chair of MSDCI, Medical Students with Disabilities and Chronic Illness, the Stanford chapter, for 3 years now. And I'm excited to be here to co-learn with each of you as we share some of the things we've been doing at Stanford and brainstorm ways for us to all be better and take this collective approach to inclusivity.
Thank you so much. So before we begin, I'm going to give us some backstory to get the audience oriented. We can go ahead and go to the next slide. And this is a preview of all the points that we're hoping to hit today. First, we'll tell our story at the Stanford School of Medicine, how we launched this office that I'm leading, the Office of Disability Resources. We'll talk about skill building and buy-in, how we quickly came to realize, or maybe even knew at the inception of all of this, that a collective approach was necessary. We needed to have access and inclusion from preclinical education through clinical skills development. We needed to offer individualized rounds to show points of accessibility and really give space for students to figure out how they can learn, so that that dynamic adaptive approach can really emerge. We needed clerkship director support, and truly a commitment from leadership. We also believe in essential expertise, meaning that students are the experts in themselves. That has always been a foundational premise of my work and part of why I both love my job and my job is challenging is that we need to promote a culture of trust. Students need to feel that they can tell me what's going on with them, what barriers they're experiencing, and first and foremost, I believe students, and then from there we go on to find what accommodations will work, how they will work, and figure out how to implement them. We'll also talk about the conversations in the community, the advocacy, the truly collective community that is pushing this progress forward all the time. And we'll look forward to how to bridge between UME and GME. So to give some backstory here, as I mentioned, I am the disability resource professional, the DRP, and you'll hear that term probably a few times today. I believe you already have. I sit directly in the School of Medicine's Office of Medical Student Affairs, but that was not always the case. My office was launched in 2023, and I am the person in charge of programmatic, academic, and clinical setting accommodations for all MD and MSPA students here at Stanford School of Medicine. So what I do as a disability services provider might sound a lot or very familiar to those of you who worked in higher ed or who've gone through higher ed with a disability. A student comes forward, they register with my office, they provide documentation, they meet with me, we identify their functional limitations, the barriers, and we draw up a list of accommodations. Students will get extended time on exams, and that is probably pretty familiar sounding. But where this work really diverges from standard disability services provision is that as having the privilege of being fully embedded in the School of Medicine, it doesn't end at classroom accommodations at all. In fact, we really think about what a student's entire experience through UME is going to be. For example, we start early and often talking about clinical skills. You'll hear today about our Educators for Care program, which is a learning community model where students right away have early clinical exposures and start developing their clinical skills. Students will need adaptive tools sometimes, or they'll need flexibility in scheduling, site assignments, really everything. And that does also translate to then transitioning to clerkships, clerkship scheduling, site locations, protocol for sterilization and conditions in the OR, procedural skills, and the whole gamut. I also make it a point to start talking to students very early about licensure requirements. As many of you may know, STEP exam and PANCE testing is a prolonged and different process when you need accommodations. You need to have very specific documentation. You need to apply for those accommodations quite early because it can take up to 60 business days to get a decision. And you're not allowed to schedule your licensure exams until you've gotten that decision. And often you will need time to also appeal and gather even more documentation. So I'm really looking to meet with students at matriculation, at orientation, going into first year, second year, third year, fourth year. And what has been essential to me having the expertise in undergraduate medical education are all of these players that you'll see on the screen here. So I am someone who I am not medically educated, and yet I can pick up the phone and call our advising deans, our clerkship directors, our educators for care advisors, and really bridge between learners figuring out what they need to getting those accommodation needs implemented. I'll go ahead now and transition and hand it off to Pri. Pri, tell us about our journey here at Stanford from your perspective as a leader in medical education and someone who does wear multiple hats. Tell us about how getting involved in disability access and inclusion came about for you.
Thank you so much, Carly. Our collective approach as a community of stakeholders with the students at the core began as a process that turned into a journey. We had stakeholder buy-in working with our Student Affairs Dean, Dr. Sanchez Guzman, our MedEd Deans, Senior Associate Dean Thomas, and Associate Dean Bernstein, as well as our doctoring course leaders, Practice of Medicine, our clerkship and pre-clerkship directors, and admissions leaders. So the process. A AAMC report and recommendation came out in 2018. It said that we needed medical education specific DRPs. And then our self-study and LCME, which I'm sure many of you are familiar with, followed in 2022 that led to a really rigorous external review and deep reflection with our inspiring national expert, Lisa Meeks. And critical opportunities were identified. So the recommendations included hiring a med school specific DRP, our amazing Dr. Carly, and then creating an office under our student affairs dean. And this one really focus on accessibility and connect with a faculty liaison, who's me. And as part of that team to connect directly with curriculum and MD experience. So this created, I think, the momentum, the funding need, and the prioritization. And this is how Carly's and my roles arose. Our charge included updating policies and websites, developing med school specific accommodations, faculty development, a toolkit, and these partnerships we described. And as this slide says, access is everyone's responsibility. So early on from the first circle, we worked with admissions to ensure welcoming language and policies and technical standards. Then moving on to admissions to M1 year. As Carly said, we work with E4C and the doctoring course directors to provide early clinical exposure and to identify early needs. This might include ASL interpreters, clinical skills adaptive tools like electronic stethoscopes. In pre-clerkship, our faculty have warmly welcomed Carly and vice versa. She has done deep anthropologic dives, visiting labs, observing lectures and clinical skills sessions like no one else. And so through her eyes, course directors and I saw the study strategies, spaces, additional time needs and impacts, the special tools we may need for mobility, vision, hearing needs. And then for MS2s, we worked with the advising deans to identify early needs for step 1. Carly and our learning specialists, they developed like 5 hours of direct support, including webinars, one-to-one coaching on documentation, also focused on clerkship draw and scheduling. I conduct access rounds, which are one-to-one walkthroughs with any student who would like to plan early, and this helps decrease anxiety, hopefully. Moving to clerkships, our clerkship directors have connected with Carly in the most direct way on very specific student situations and facilitating the introductions to support accommodations. Through this, we were also able to enable observation where Carly dove into clerkship rounds, call rooms, work rooms. She completed scrub training. She observed in the OR. And as a result, she could make informed recs about the length of rounds, rest areas, individualized schedules, clerkship order recs, standing desks and stools, and other tools. And finally, for our career training advice, our office has worked together, working with advising deans, mentors, and program directors about whether accommodations will or won't be reasonable in a specific specialty. Sometimes even alumni come back when they're in need of advice and retraining ideas. And then in my role as advising dean, I'll be pairing our specialty career advisors in each department with a representative who has a disability in that department and who can describe the career path and the potential positive practices and potential challenges. So you can see that our collective approach touches all parts of OME and ties into student lived experiences as well as the curriculum.
Thank you. John, tell us about the E4C program, our learning community model, and why was this a good fit for supporting disability access?
Thanks, Carly. So in this slide, what I want to talk a little bit about is how the E4C program fits in, but actually really how all the pieces come together. We tried to put the student at the center of this. At the end of the day, that's really going to be the most important piece. Everything needs to revolve around the student and needs to constantly come back to what's working and what isn't for each individual student. Our E4C leaders, we act as clinical skills teachers and coaches. We help students with professional identity formation, and we really like to think of ourselves as the first responders. We're lucky at Stanford that we have a large group of fantastic E4C who really get to know students from literally the first day they're on campus until they graduate. So we're actually able to really get to know these students at a very individual level. For any student who is struggling or maybe thriving but still needs to have certain accommodations, the E4C can be the first responder, right? So if a student is struggling, they can come to us, we can come to them and try to work on, where are things not, why are things not working out well? We like to say the E4C are the first responders because we don't have all the answers, but we can triage students to get them to where they need to go. The E4C also, we have what we call vertical mentorship. So our first years and our second years and our third years and our fourth years, we get together and we can have older students who've been through that year help mentor the younger students. And we also think that for any student who's struggling with a disability in school, can meet with other students who may be actually thriving and can learn from each other. They can learn from mistakes, successes, whatever that might be, and really provide a lot of support. Similarly, we need to work with our learning specialists, our disability resource provider like Carly, to understand what is going to work for our students. And then I think, Pri and Carly both already alluded to this, but as a course leader, right, as the person who runs our medicine clerkship, this has really been such a huge change in what's happened in the last few years at Stanford, where we can actually have fine course-specific accommodations that really make sense for our students that are going to allow them to succeed. All these different groups need to work together, but I really just want to emphasize that the meetings that we're able to have that Carly sort of facilitates between our course leaders and the student and then Carly to figure out a plan that actually works. Before, years ago, what would happen is, as a course leader, I would just get a list of accommodations that I need to make happen. And a lot of times those things were just sort of unrealistic. They clearly were set out by someone who didn't really understand the learning environment. They especially didn't understand the clinical environment. There are certain things in the clinical environment that are out of the educator's ability to change. I can't make massive changes in the way the hospital runs. And so really working hand in hand with both the student and with Carly to try to figure out, okay, some things I just can't change. But what can I do to make sure that that student still thrives, to make sure that they meet all the learning objectives that I want them to get out of my clerkship, given the constraints that we have? It's really those conversations that are going to be so important. And we wanted to put this slide up here to show how that this is a constant stream of learning. We have to keep learning from our students. We need to continue to learn from each other so we can put forth a path that will allow every student to succeed.
Thank you, John. And I also just want to address a question from the chat about what can people do when they're at institutions that don't have such a robust infrastructure. And I want to comment that those under-informed accommodation letters from a few years ago, those also came from me. I used to be a generalist disability services provider. I did not know anything about the clinical environment. And all of my learning over the past few years really is standing on the shoulders of you all as my partners in this and leadership, including Dr. Lisa Meeks, including all of the research that's been coming out nationally, including Pete Poulos and SMATI and MSDCI and our MedEd leadership that was named earlier. It's been an incredible learning journey. And speaking to that, speaking to the community and the progress and also the mentorship that you mentioned, Amy, my next question is for you. As someone who is finishing up preclinical, finishing up your research, you're transitioning to clerkship soon. You've also been leading the Stanford chapter of MSDCI and serving on the board of MSDCI National. In your view, and tell us more about the role of community organizing and what this has done for disability access and inclusion for us.
Absolutely. Thank you so much for that question. And I think as Dr. Meeks just shared in her wonderful keynote, it's so important for us to have a distributed responsibility for all of us to be stewards of equity and access. Drs. Basavia and Kugler did a beautiful job of showing what that looks like in terms of partnering with the educators, administrators, and staff. And now I'd like to highlight specifically what students can do during both the pre-clerkship curriculum, and then Georgiana will talk about her experiences with clerkships as well. I found it so important during the pre-clerkship journey, so prior to entering clerkships, to have multiple opportunities to learn with and from our peers with disabilities, both inside and outside of the classroom. So we talked about our practice of medicine course, which is intended for our first year medical students as well as our second year medical students to really prepare them for what medicine will look like as they enter their rotations in the future. And I believe in the first few months of students getting here and starting medical school, a couple of our practice of medicine sessions are actually specifically dedicated to disability in medicine. We have speakers coming in, folks who are trainees in medicine, folks who are physicians, residents and fellows who have disabilities, and they talk about their experiences on what I like to term this side of the white coat. What does it look like to both have a disability as well as work with different patients with a myriad of different chronic illnesses and disabilities? And why those sessions are so important, I think, is because as we come into this space, we oftentimes, some of us may understand and know the term disability as a form of identity. And other folks may have been, for example, diagnosed with a chronic medical condition, but may not necessarily identify as disabled. And that's okay and valid too. I think everyone's identities and journeys are so different, but that's exactly why it's so important for all of us to have this sense of community and shared responsibility as we co-learn together. And so what that looks like outside of the classroom has primarily at Stanford been led through our student group, MSDCI, Medical Students with Disability and Chronic Illness. One thing that we've loved doing is hosting these panels, these Ask Me Anything panel events, which share about disability at the intersection of different identities. So what we've done is we've partnered with numerous other student organizations within SUMA, which stands for the Stanford University Minority Medical Alliance, as well as partnered with the Office of Diversity in Medical Education, and of course, SMATI and other key partners here. And our goal with all of these panels really was to make space for the real emotions, the questions, big and small, and connections, so that our students can talk about disability in a real way without being afraid of being ostracized, without being afraid of being judged. And truly throughout this, we try to center the ideas of community and candor, being open and honest with each other, sharing the idea of, what has been a challenge for me and what has been a joy for me, what has been easier and harder in my medical training. And I myself have benefited so much from hearing from our students. As Dr. Kugler said, this vertical mentorship idea has been really key to our success and leading to self-efficacy, the confidence that students have as they develop as, hey, medicine is a place for me. Next slide, please. So when we think about this idea of community organizing, I think it's also really important for us to center and recognize the challenges that disabled students face within medical education, as well as the opportunities we have to come together and address them. Here on this screen, you see a non-exhaustive list of some of the challenges that may arise as students with disabilities go through our medical training. This includes stigma, adjusting to new learning environments, and the ideas of dynamic disability. And so a few things I'd like to highlight here specifically include, again, this idea, coming back to your question, Carly, of fostering community. I think one thing that has been so essential, and why I keep saying community of other disabled medical students, has been helpful because we get to model the ideas of disability disclosure. I think the question that I had when I first came to medical school is, do I hide my chronic illnesses? Do I share it with people? But what do I share? Whom do I share with? And what does this look like in different environments? And I think what has been really helpful is me seeing other students, as you'll hear from Georgiana in a bit as well, the modeling of what that looks like. How do I disclose my disability? How do I advocate for my accommodations needs in an unfamiliar environment? Maybe I've never been into an OR before, so how am I supposed to know what are the different accommodations that would be helpful to me in my body at this current time? And so one of my favorite resources that Stanford MSDCI has been developing are these anonymous guides that are actually written for and by students. These are anonymous Google Docs that talk about the real experiences that our students are having through different levels of training, because you don't know what you don't know. And that's why this idea, again, of intergenerational vertical mentorship between preclinical and clinical students is so crucial. And this is something that we, again, are currently in the works of developing. We certainly aren't perfect, and we're learning together about ways for, hey, as our students go off and graduate, what wisdom do they have to share with maybe the incoming students? And so we can continue having a list of little tips and tricks that have been helpful to our students, again, as a form of sort of trusted community and identity sharing throughout that.
Thank you. Georgiana, as someone who is finishing your third year of medical school and your first year of clerkships and looking towards your final one, I am hoping that you can tell us about your disability and your education experience here. What made you decide to pursue medicine, and what was it like moving through all of these phases of education, especially now that you're looking to the next phase?
Yeah. Yeah, happy to be here today and kind of echo off a lot of you all and the things that you've mentioned this morning about how this is really teamwork. I think for myself, a little context for me, I have a spinal cord injury, so I have some significant paralysis in my lower extremities and also, internally with spinal cord injury, there's a lot of bloopers, is what I like to say, of just life. And oftentimes, as a medical student, just a general medical student is going to be anxious about the next steps of clerkship. And I think having added a disability does add an extra component of uncertainty that, makes you worried about when am I going to find time for health maintenance or to take care of these like bloopers that happen in life. And I think for me, the theme I've been kind of living by, as supported by you all as faculty, is feeling that like flexibility in the curriculum for trial and error. Just to reiterate, every disability is so different, and so not one thing is going to work for every student. And that requires trial and error with the flexibility to not always have that reflected in evaluation if you need the room to take care of yourself if something doesn't work in the way that you wanted it to or expected to. So it's, from my experience now, having finished 1 year of clerkships, which is crazy to think about. I feel like it was just yesterday we were trying to navigate the order or structure that would optimize my health of each clerkship, but also give me in time to figure out what I'm doing with my life. I think at the end of the day, while we are here to talk about disability, we also need to remember that a student with a disability in medicine also needs to follow their passion. And for me, coming to med school, I had a ton of experience and exposure to healthcare, just as many of us do living with disabilities. And it was just kind of something I always imagined I would do. For a long time, I thought I would do something like neurosurgery. And then while you still definitely can with a spinal cord injury, I just realized it wasn't really the kind of lifestyle I wanted to have. And I'm now kind of navigating that and trying to figure out, what is my passion and how do I preserve my longevity and my health. And I think one of the things that clerkships teaches you, kind of to juxtapose against the pre-clin environment, is that you're learning so much in pre-clin and you might have a passion going into clerkships, but then you also need to find a balance of how to realistically see what the training in that relative specialty of interest is like. And try it out, try it fully as much as you can, and then let yourself have those moments to realize maybe this isn't for me, because maybe there's physical capacity that I just don't see for my future and I want to preserve longevity, or maybe it's totally fine. And so I think for myself, going through each clerkship, starting on surgery to see if it was a possibility, it definitely is. I think for myself, there were just components that I didn't really want to always have to kind of jump through loops for. And so I would say, um, it's been, again, trial and error, trying to figure out how can I meet the learning goals, but go beyond that and see what residency would be like for each relative specialty. And I think that is something that there is not one answer to. It's very student dependent. And like we've kind of mentioned already, there's this idea of disclosure and In my own personal experience, I have a more visible disability, so disclosing is not really and sometimes an option. It's just sometimes forced. And for myself, I feel like there are more things I choose to disclose to certain people so that they can help me see, with the full context of myself and my abilities, what would this career be like for me? And that's been really helpful. And I've found a lot of support. Of course, there are times where maybe it hasn't gone that way. And I think fourth year has really or third year has really taught me the finding the balance in that, and I'm still trying to figure out those answers of what am I doing with my life, and I'm gonna probably be the person to decide very last minute when it comes September for applications to residency. And honestly, that just goes to say how well Carly has done with trying to help this curriculum be accessible and equitable. I've truly enjoyed almost every single clerkship as about the same, and so it's really hard to pick what you want to do. um, I think the other things to kind of consider, is that there is this idea of uncertainty, and sometimes it's nice to have a framework. And so, this slide that I have here, is basically what I've taken away from the clerkship experience, kind of as a framework to help people approach or navigate this puzzle of how do you do clerkships with a disability. And so the first being everything is personalized. So that being an equitable learning experience for that given clerkship for the individual needs. And that comes with all the teamwork we've discussed between the faculty, the residents, the students, people like Carly, and of course the clerkship directors. So very clearly establishing communication from the get-go, as Carly has done with matriculation, starting off, getting these people plugged in. And then you can click next for me. So then what I like to think about is aligning the learning goals. I think with clerkships, obviously each one comes with different learning objectives. And so how can we align that with the goals of the student, whether that be, oh, I'm super interested in this specialty, but I might have to complete the residency a little differently. How can I still see it to its full capacity? Or just maybe there are certain objectives of the clerkship that could pose like certain barriers. And like Dr. Kugler said, that's when you get together and you communicate. You talk about, these are the objectives. I want to help you get there. Maybe there is a barrier, but I think there's a way we can come up with something creative. And so that really just comes with support. Um, I think there's always ways every student can accomplish every single learning goal, and it just requires teamwork. I think then setting the expectations, and I think this is pretty important, and um, I feel like Dr. Kugler does a very good job with this when approaching like the medicine rotation, for example. So he's really thought through what are the challenges and concerns, that I need to address with the student prior to beginning the clerkship. And I think this is important to discuss before initiating the start of the clerkship so that the student's not entirely thrown off. I think living with the disability, you're constantly adapting, but to have a little bit of predictability is very helpful in making sure you can take care of your health needs. And so I think there are certain expectations to set about, the concept of rounding, the amount of like OR time you need for given cases, even pre-rounding, the quickness and speed of it. I think there's things where you just um, want to talk to the student beforehand about, um, these are things I want you to consider when doing the clerkship, and we want to help support you in that sense. And then also, like on at least at Stanford, we have like night shifts, and those can be challenging to adjust back and forth to with given like health maintenance at home. Um, and so setting those expectations up of the challenges beforehand is always really helpful to the student. And then again, communicating needs. I think this one is also very, very important in my experience. When it has been done well, it's amazing, but when it hasn't been done well, it's a whole lot harder for the student. And so what I mean by this is working with a clerkship director, as a student to come up with an email or something to send to the attendings and residents that you will be working with the amount of disclosure that you choose. And for me, that has been super helpful just to go ahead and, kind of bridge this relationship, establish that, hey, we have a student coming on that needs this kind of support, and want you to all to be aware. It works really well when people read the emails, and sometimes they don't. But I think having that sense of just communication already established between clerkship director and the teams that are relevant to the students' training, is very essential to their success. And sometimes it doesn't happen. And I think that's when, as a student, you will find yourself repeating yourself a lot, which is natural. It's going to happen all throughout training, all throughout residency. But finding the ways to feel comfortable doing that and disclosing. One added piece that was personal, I think that I really appreciated from one of my clerkship directors was that in an email to the entire teams I was working with, it said, you know, this is the student's context. They have a spinal cord injury, blah, blah, blah. However, student is very open to discussing their disability. So please don't hesitate to ask them to participate or ask them how these might be challenging. And I think that was really especially helpful in my surgery rotation, where sometimes an email like that can do the opposite thing, where they almost don't want to include you because they think that maybe you're not interested or it might be challenging, but instead it was like, no, here's the precedent. The student wants to be as enthusiastic and participate as much as they possibly can, and that comes with the support from you to see what's possible, especially if they want to consider it as a career. And then lastly, evaluations. This is one that I think is a conversation that's like constantly changing across medical schools, in the sense that we historically have evaluations that where language has always been linked to performance based off of ability. And so I think with Stanford, we're constantly having this conversation of better ways we can evaluate ability on the clerkship experience. And so I think there's always this fear as a student that you're not going to be perceived as working hard enough with your given circumstances. Say, like for myself, there were occasional days where I had to leave early for health maintenance. I didn't want the team to think I was disinterested or didn't want to participate. But I addressed with them, I will very clearly like make sure my responsibilities are complete so that I can go take care of my things that I need to do. And it's kind of something that looms in the back of your mind as a student, that because of those needs, because of the additional things I have to consider, I won't be evaluated the same as my peers. And so I think really doing away with performance based off of ability is something we all need to push toward. And I think I'm very grateful that I think our curriculum has done a good job at that. Um, and so just finding also alternative ways to evaluate, say you're a student that can't complete a certain objective or type of exam. So having an assistant come and help you and talk through with you and be like, what are the findings you want to consider? Those things to make sure it's still an equitable experience and meets those learning goals, kind of going back to aligning the learning goals. Um, and so I think these are kind of the things that I feel like I've taken away as a good framework to approaching the clerkship experience, and hopefully aren't just can be applied to multiple kinds of disabilities with different needs. So yeah.
Thank you. Georgiana, do you want to finish this slide as well?
Yeah. I think I kind of made this as the perspective from my physical disability, just a more personal anecdote. I think the smiley faces and unhappy faces make a good visual representation of kind of how I associate certain things on the clerkship experience. And so kind of starting off on the right, I think what's hard about clerkships is obviously you need to see different sites and different kind of experiences, the way different kinds of hospitals run. Sometimes commuting to those sites can really cut into health time. So finding ways to work with the team so that you can still like prioritize your health, but still see the things you need to see while on clerkships. It's something that is just hard, and I had a hard time with it personally. But I also saw the necessity of it. I'm very grateful for the experience. And I think the biggest thing from this box itself is just navigating the stress around specialty selection is quite challenging as a student with a disability. I think we look at in the pre-clin experience, we shadow attendings, we see what their lifestyle's like. Not to say that it always gets much better as an attending, but I think the big barrier for a lot of people is residency, whether it's based off of ability or not. And I think for myself, there are components of a lot of residencies of specialties that I'm interested in that will be very, very hard on my body. And so trying to see realistically what that looks like as a student is quite hard, especially when, you don't always have that representation in each relative specialty. And because every physical need is so different. And so that's one thing where I think looking back, I have some regrets on maybe not trying to get that exposure quite as early on in the pre-clin experience, which I think now we do a very good job at. It's just that I was kind of at a time where I didn't I came into the experience not having um, these questions early enough. And so I think that's been one of the kind of the biggest unhappy faces that I would associate it with. And then also rounding, quite physical. It's long, it's hard, it's challenging to stand for that time. And I think walk rounding is something that really um, for learners and educators out there, I think it's not very considerate to, walk and talk while people are trying to keep up. Maybe you can't write while you walk. There are things that I think we need to reconsider in those circumstances because then it's not an equitable learning experience for the student. And so that's one thing that always kind of bugged me on rotations as well. And then kind of in the middle, it's just accommodations. I already said this, not always being read by your team. And so I feel like there's some constant tiptoeing around what's going on or having to constantly repeat yourself. But I think that will, that's more of a culture change that I hope will happen with time, with more experiences like this for people. And then otherwise, I think one of the amazing parts, to end on a more positive note, is that living with a disability gives you lots of perspectives and reminds you that as people who interface with the healthcare system, not on the white coat side so frequently, each day is the biggest day of your life. The impact that one interaction can hold on you as a patient is so strong. And so I feel like living with this perspective and this lens, I remember that so clearly when I come into patient encounters, that this is one of the biggest days of their life, just as it was for me. And so I think it helps educate other trainees and peers to remember the same thing. And to yourself, to remind yourself to not, always get desensitized and burnt out. It's like, this was you. And this still is you on occasion. And so remembering that to kind of hold this unique perspective and lens and also create that kind of relationship with patients, I think is really awesome. I feel like it's very rare to have that kind of vulnerability kind of reflected back to you as the provider. It's so often that we see patients and they're in this vulnerable position, and sometimes it can flip to you. And to give your perspective is oftentimes so helpful to the patient and really bridges a wonderful relationship. And I also think other things, it having my spinal cord injury has really been such a fun experience too for me learning with my peers and how we can create adaptable change within the learning environment, especially like with my roommates that I live with. And then on the clerkships itself, like one of my friends was actually the one to help me figure out I should use an ultrasound probe cover to sterilely cover my mobility aids. And so just getting creative and learning together has been such a fun thing for me to be able to see. It makes me feel very proud of the institution I'm at and the people I'm working with. And overall, is honestly, clerkship years have been such a wonderful experience. And so I'm happy to share and always answer more questions about it.
Thank you so much. Let's go ahead and stop sharing, and we have about 9 minutes for open discussion. We have lots of good questions from the audience, but actually the first question is from me because as I'm listening to you speak, Georgiana and Amy, I'm really thinking about that uncertainty and the iterative process of learning, and how really when there's a little bit of a danger in the way that we approach this work by centering you as the learners who are experts in yourselves and the people who are learning medical education. And that the danger is that it also creates a burden on you. You're the ones that are having to both show up as medical students learning on clerkships, but also learn and figure out what your disability access needs are going to be. And I really want to just hold space for that tension, and just recognize it. And I wonder if you can speak to both grappling with the uncertainty, but also how can we as MedEd leadership better take on the sharing of that burden?
Yeah, I think that's a wonderful question. And I do feel like throughout the last year, I was constantly getting asked, what are things you think we need to support you? And I'm like, I don't know. I've never done this. And that was the constant conversation. And I think what I found to be wonderful from a most recent experience, for example, I'm on the OB-GYN clerkship right now. And the clerkship director asked me this question, and I was like, I'm honestly not sure. I've never even seen a baby delivered before, so not a clue. And what we did was we went and simulated together an experience after our orientation day to figure out how I could navigate a room, either with my wheelchair or with my other mobility aids, and how I could participate alongside a resident to help deliver a baby. Because she fully understood that, you know what, I need to take the time because I don't know either, because we've never met. And so I think while it was time we both had to take out of our day, it was very helpful because then it made me feel more confident going into the clerkship experience. Just because, again, like each clerkship is incredibly different and comes with different sets of needs and expectations. And so having educators take the time to help you figure out before starting is like, I think, one of the most useful tips that I've seen and learned and been on the receiving end of. Otherwise, I do think, it is, Amy, I'm sure you can speak to this too, but it is hard to navigate this uncertainty and um, not really knowing what comes next outside the protections of med school. And I think most um, the things that keep me kind of awake at night wondering are how will I do this in residency when I don't necessarily have the kind of support that I've been given in med school and training here. So.
Yeah, absolutely. Echoing and adding, I think, particularly, we talk about how diverse disability is, and myself living with multiple chronic illnesses, I refer to them as dynamic disabilities. It's often living in an unpredictable body. Sometimes I wake up and I don't know how I'm going to be feeling, and so I recognize, of course, like dependability, reliability is so important when you're scheduled for a shift. When you're here, you're supposed to be taking an exam, you're supposed to be doing these things. And so trying to figure out like where is there room for maybe building in time for uncertainty versus where is there room for maybe just communicating in advance and hoping for the best and seeing what happens, which I know doesn't always feel like the most satisfactory answer. But those are things that I'm grappling with as I will soon be starting clerkships actually on surgery. Similar to Georgiana, I wanted to try it out first and see how that goes. And I've been reflecting, during my time in pre-clerkship, really this importance of early and often brainstorming. And so I think all of us have really touched on these different ways in which we can talk to other community members. Like, George, you will be receiving a text from me very soon so we can chat prior to me starting clerkships, right? As an idea of this vertical mentorship. I think Carly, for example, has been doing an amazing job even meeting with some of our admitted new MD students, M0s. They haven't even started here at Stanford. And they had some questions about access needs that I was able to answer partially as the Stanford MSDCI chair, but also I directed them, hey, we have a very supportive administration, and these are more some logistical questions that maybe you should be asking our admin. And all of them kind of came back and said, oh my goodness, I can't believe that they were willing to talk to me about this. I'm often told as a pre-clerkship student that now is the most time you will ever have. And so I'm really trying to use that time to, as much as I can, figure out what advanced planning can I do. And so part of that has been during our DRP meetings, like my one-on-ones with Carly, also trying to brainstorm what a highest access needs day looks like for me. And so what are the types of supports that have been helpful to me in the past when I'm in a very big disease flare, right? If I do decide to come in, to my rotation that day, are there specific things? Are there breaks that would help me? Do I need to go use the restroom more? Are there specific types of medications that would be helpful for me to pack in advance? And so I think while brainstorming doesn't solve all the problems, it certainly, I think, makes me feel better, more prepared to then communicate those access needs to my preceptors who will be there on rotations. And it's been helpful to the moment I got here in pre-clerkship. I've talked to each of my faculty mentors and said, hey, I'm committed to being here and learning, and I'm excited for that. Unfortunately, today is a very high paying day. So I'm happy to participate, but would it be okay if I'm sitting down for this part? Or, hey, I brought my portable heating pad. Is it okay if I use that or charge it in the corner during class? And so trying to think of more potentially creative out of the box solutions, again, just by asking other students. Stanford is not the only place that has an MSDCI chapter. There's 56 nationally and counting. So I encourage you to also visit the MSDCI national website, visit things like Docs with Disabilities Initiative that have a whole long list of brainstorms of potential accommodations that could be helpful. Of course, recognizing every single person's body and access needs are different.
Thank you. And Pri and John, we only have a minute left, but I am hoping that you can also speak from the administration side of this same question, this tension at the heart of realistic constraints of practicing medicine, but also as educators, what is the role of professional identity formation, disclosure as help-seeking behavior, and balancing all of this with the reality that learners are probably going to face ableism at some point. So I would love to hear your final thoughts on this subject.
I can start off and hand off to John. Part of our core mission for Educators for Care is really to talk about our professional identity formation, to have constructive discussions, and those built on trust. So I'm hoping that people saw today that whether or not we have those types of resources in our individual institutions, we have a collective community across this country and through this sort of virtual community where we don't need to reinvent the wheel, where we can partner with our students, either through MSDCI or through these communities, and truly understand hearing each person's story, trying to meet them where they're at with compassion and pragmatism. Since students are experts of their own bodies and their own lived experiences, at the same time, when they're asked, what do you need, as Georgiana and Amy said, they don't know necessarily what's possible and what the new environments and expectations will be. So having a culture of administration and leadership, understanding that it's not one size or one formula that fits all, that we really do right by the students by creating these individualized plans, and we can get the information from one another in case we don't have this centralized infrastructure. So, John?
The main point I would want to make is just to continue to listen and learn from your students. I think even just hearing about Georgiana's experience on clerkship has made me learn more about my own clerkship and where some of the pain points are. Similarly, listening to them about what are they worried about looking forward to residency, because for every student it's going to be different worries, it's going to be different concerns, and if we want to build an educational environment that's going to work for every student, we all need to be, having these discussions as well as talking with the leaders of residency programs, so that they can be prepared for students to make sure that they're successful in those fields.
Thank you. And with that, our time has come to an end. We will answer questions in Slido to the best of our ability. Thank you everyone for joining today and helping to showcase what we have built together and are continuing to build. It is by no means done. And thank you, Smatty, for having us.